Hello everyone. Welcome to Yashoda Hospital's online segment, the Health Talk session. In today's episode, we are going to discuss various aspects in the field of rheumatology. I'm Dr. Lakshmi and let's welcome consultant rheumatologist from Yashoda Hospitals, Secunderabad. Welcome, doctor.
Hello. I'm Dr. Keerthi Talari, consultant rheumatologist at Yashoda Hospital, Secunderabad.
So, doctor, tell us more about yourself and your journey in this medical field.
Basically, I'm completely from Hyderabad. So, I've done my schooling from Johnson Grammar School, and following that, I've done my 11th and 12th at Kakatiya Junior College, and then I did my MBBS from 2003 to 2009 at JIPMA and JIPMA Pondicherry, and then I've done my MD internal medicine from 2009 to 2012 at JIPMA again, and I've done my DM rheumatology from NIMS, Nizam's Institute, between 2012 to 2015, and from 2015 I've been working at Yashoda.
So, doctor, what made you choose this medical field? Did you want to become a doctor from your childhood days itself?
Basically, the very fact that I've become a doctor, I would say, is more by chance. My mother's sister was a doctor, and every summer holidays I spent with them. So I used to go to Vizag. So I used to go with her to all her clinics. Probably that influenced me. I don't know why I just suddenly told in my class 6 that yes, I'll become a doctor. So when I entered 11th, they've actually asked me at the college, what is your goal? So my answer to them was, I want to get an MBBS seat in my first attempt. When I came into my MBBS final year, that's when I realized that internal medicine is the thing. If an internist is the one who can pick up any kind of case. So I love that thing. So internal medicine is something that covers the human body in entirety, and that's how I've decided that I'll do internal medicine. So I was the best outgoing student in MBBS, MD. I had like 26 medals by then, so my entire family was not okay with the fact that I settle off as a general physician, so I had to think which specialty to choose. But I've chosen rheumatology primarily because it looks at the human being at entirety, so it's not focused to a single system. This is one specialty where anything can happen to any part of the body, and that's how I've actually landed up in rheumatology.
So that's wonderfully said. So you've just mentioned that most of the patients turn up to you at a later stage in their illness. So is that challenging?
Yeah, exactly. So that's what happens with most of the rheumatologic diseases. Number one, people are not aware of it. Number two, it's really difficult to diagnose a rheumatologic issues. The most important thing that we deal with is arthritis. So we look at joint pains, joint swelling as the most common symptom. And most of the patients who present with arthritis primarily go to an orthopedician or a physician, and that's how they come to us. They are referred by them. The next important group of diseases that we deal with are autoimmune diseases. So autoimmune diseases are basically diseases where our immunity attacks against our own self. In this particular place, they get referred very soon because the multidisciplinary team that we have helps patients to come to us pretty soon. But if you actually go to a district level or to a village level, it becomes very difficult for them to reach a rheumatologist, and by the time they reach, certain times it could actually take them years before they reach a rheumatologist.
So let me ask you the basic question. When should one see a rheumatologist? Because I'm sure most of them do not know this.
So as I said, rheumatology primarily deals with anything that's related to the immune system. So it basically deals with autoimmune diseases, and the most of the cases that come to us is where their immunity affects their own joints. So these all come under a category called inflammatory arthritis. So if you have joint pains and swelling with a lot of stiffness when you get up early in the morning, this is what is called an inflammatory arthritis. So the stiffness will last for about 30 minutes. You'll have pain at joints and you'll notice that your joints are getting swollen. Now when I say inflammatory arthritis, the general opinion that is carried into the society is that joint pains are something that happens in the elderly, but inflammatory arthritis is something that happens in the young. So usually we see inflammatory arthritis somewhere in the younger people, somewhere between 20 to 50 years being the most common age group, but it can also happen in children as young as 5 years of age too. Now, leaving this aside, the other autoimmune conditions actually affect different parts of the body. So, there could be autoimmune diseases of the lung, autoimmune diseases of the kidney, and each one has a different name altogether. So, we do not expect that these patients would outrightly recognize that I have an autoimmune disease, so I have to meet a rheumatologist. It's again definitely the other specialist who should be able to tell you that you should meet a rheumatologist. So, meeting the other specialist becomes very important. So, if you are actually suffering from a kidney disease and not knowing the reason for it at a very young age, you should meet your nephrologist, because they are the ones who will be able to tell you that yes, this is an autoimmune disease and you have to be managed as a whole. Like, it's not just the kidney, it could actually affect the other organs too, and that is when they'll ask you to meet a rheumatologist.
I'm sure rheumatology is a very challenging field because most of the patients, they present with very vague symptoms. So doctor, tell me about one challenging case what you have seen in your career so far.
When it comes to talking about one challenging case, I would say that any lupus patient that I see is a challenging case to me, and that is why I chose that particular disease as one disease which is dearest to my heart. And unfortunately, what happens is these people are also prone to infections. So it's not just autoimmunity that they have, they also get recurrent infections. And whenever I win that battle for them, I feel that is the maximum satisfaction that I get. That's the maximum professional satisfaction I get when a lupus patient comes in the worst state, admitted in the ICU, and comes back after like few months, they come to the OPD in a very normal state. That I think that is what professional satisfaction is all about.
That's great to know. So apart from your work life, what else you would like to do in your free time?
Here, I would say definition of free time is something that we should define for ourselves. So anything that does not work is equal to free time according to me. So as a child, I've not done anything beyond studying. But yeah, I always had that thing. I used to like music, I used to like dance, but I never gave time to that. Specifically spend maximum time with my child, and I think whatever time I spend with her, be it in her studies or be it in her playing, that is all free time for me. I'm actually learning Kathak, so that is one thing that I'm doing now for myself. I love cooking. I try new recipes at home, and everybody else at home is a scientific experiment for me. I put they have to eat whatever I make. Even before I taste, I make them eat. So cooking and I think as of now, dancing are the most important things. People think I actually sing well also, but it's not actually my passion.
That's really wonderful to know that you're involved in many other activities apart from your work. So you've just mentioned that you were a very studious child, reading and studying all the time. So do you expect the same from your children?
Not at all. The last thing I would tell her to do is to read like me, because I think as a child you should enjoy a lot of other things.
So doctor, in this successful journey of yours in this medical field, what is the role of your family?
Yeah, so I would not talk about my childhood as such. As I've told, my mother is my strongest pillar. Whatever I am today is because of her. My teachers are my second strongest pillar. Today, my biggest strength, I would say, is my husband. Whatever be it, whatever people say about women moving far ahead of what they were in the past, I really believe that even today, a woman has to juggle between her personal life and professional life. She has to be great at multitasking to be a successful person. That is what I believe. And to juggle between your personal and professional life so well, you really require a great family support. And for that, I would say my biggest support today is my husband. Along with that, like my in-laws stay with us. And every time I just walk out from the house whenever I want is totally because my mother-in-law and father-in-law take care of my child whenever I'm not at home. So I think my family is my biggest support.
Undoubtedly, family support is the most important thing to excel in this field. So before ending this episode, what message you would like to give to the upcoming doctors out there?
Medical profession is no longer what it was in the past. The charm that it was there, if you're a doctor, you're given this respect in the society, frankly, I would say is no longer there. And medical profession, I mean, becoming a doctor also means giving up a lot of things in your life. So you'll have to be like really strong, you'll have to multitask, you'll have to do a lot of things in your life. If you have to be a doctor, you have to handle a lot of other things along with handling your profession. So if you want to become a doctor, choose that profession only if it's your passion.
Thank you, Dr. Keerthi. It was lovely talking to you.
Thank you.
So this brings us to the end of this episode. Thank you all for watching us, and do join us for the next week as well. Take care and stay safe.